So, Vicky, we've already discussed that conscientious objection is not I guess, a defence against the childcare benefit, childcare rebate and the family tax benefit Part A payments, but you can still be a conscientious objector with regards to enrolment in childcare. Is that correct?
Yes. And so this is when we get to specific state issues. So in our Public Health Act, we changed it a couple of years ago to tighten up the vaccination requirements to enrol in childcare. And so the Act does specify that this conscientious objection is a valid mechanism to get to enrol in childcare in New South Wales. So with the new no jab, no pay measures, the old conscientious objector form, which was published by the Commonwealth, isn't available anymore. And it's not recognised by the Commonwealth.
Right.
So what we've had to do is develop our own New South Wales an interim vaccination objection form so that families that are conscientious objectors can enrol their children in childcare in New South Wales this year.
Yeah. What happens to those children who aren't vaccinated and say there's a local outbreak of pertussis? What happens to those children who are in childcare but not vaccinated?
Well, other parts of the Public Health Act still apply, and they can be excluded by the Public Health Unit during that outbreak.
Great.
It's not changed at all.
Okay. Now, we've just heard from Dr. Tinker that best practice have said that links to the ACER for over 7s won't be active until the next upgrade. So thanks for that information. Yeah. Yeah. Right. And this is the new conscientious objector form?
That's right. So this is a screenshot of our New South Wales Health website. So we've got a page about childcare enrolment, and the links to the new form is on the right-hand side there as shown.
Okay.
So if you click that link, this is our new South Wales Health interim vaccination objection form to enrol in childcare centres, and it's similar to the old Commonwealth form, but we've made some important differences, and we've tried to make the discussion between the GP and the parent more explicit about the risks and benefits, the risks of not being vaccinated and the benefits of being vaccinated.
Yep.
And so it needs to be signed by the parent in the middle there, and the GP down the bottom of the form. Also, an authorised nurse immuniser can sign the form.
Now, are GPs compelled to sign this form?
No, they're not. But from a legal perspective, so if a GP has their own ethical objection to signing that form, that's fine. But we'd suggest that that's made clear to parents before they've paid for a consultation. But there are legal protections. So by a GP signing this form, it doesn't bring any liability on them should the child then go to childcare and have a vaccine preventable disease. So, you know, the doctor's fulfilling their duty to provide their patient with information, but also to respect the patient's right to make their own decisions.
And one of our participants, Vicky, has asked, will the number of these forms signed by an individual GP be audited?
No, there's no auditing. For these vaccine objection forms, but we'll go on to the medical exemption form in a moment.
Okay. So these are the medical exemptions.
And this is a Commonwealth medical exemption form. And it's been tightened up. So it really is now requiring anaphylaxis or a severe allergic reaction. And in those cases, we'd be expecting consultation with the adverse event clinic at Westmead to help understand what happened in those situations.
And I have rung that number a couple of times regarding parents who have said that, you know, my child is immunocompromised and shouldn't have the vaccine, and I've said, well, I've rung the special clinic at Westmead on that 1-800 number and been sort of advised that you know, they maybe should have the vaccines, because they don't fit the criteria for a medical exemption.
That's right. So, I mean, in many circumstances, the local public health unit can help with those questions, but that's when it's complex questions about adverse events, we have this service available for GPs, so encourage people to use it.
Yeah. We've got a couple of questions here along the same line, Tim, regarding proof of immunity, natural immunity. How is that done?
Well, so the natural immunity is a recognised medical exemption, but only for a limited number of conditions. So that's hepatitis B, measles, mumps, rubella, and chickenpox. So a clinical for chickenpox, certainly a clinical diagnosis, a certification is perfectly acceptable. For hepatitis B, only serology would be acceptable, serology showing immunity or past infection. And for measles, mumps, rubella, we strongly recommend that either if it was an acute illness and so that the PCR was done, or serological immunity to demonstrate, because those three infections are very hard to diagnose with any certainty clinically.
Yeah. And DTP, we can't really prove that serologically.
No, there's no opportunity to give a
diphtheria, tetanus, and pertussis.
A medical exemption unless the child has had anaphylaxis to previous vaccine or vaccine component.
Yeah.
I think it's just worth clarifying the difference between those forms. The New South Wales childcare form is a form where you're signing saying that you've discussed it with the parent, and the medical exemption form is a medical certificate saying that they have an exemption. So so there's a sort of a clear difference. I have also come across recently on the anti-vax website, there's a sort of a form that people might bring in to their GP saying, I don't consent for my child to be vaccinated. And so if that's the case, then they don't get a vaccination. It doesn't exempt them from the Centrelink payments or anything. And I would argue that if they actually don't consent for their child to be vaccinated, then the child doesn't get vaccinated. That seems pretty clear, I think. But that's not an exemption to the Centrelink payments. They still won't get paid even with a form that says that.
Tim, we've got the false contraindications to vaccination listed on this next slide. Do you want to sort of pick the eyes out of this for us?
Yeah, this is important because I think there's a lot of myths out there about what is a contraindication to vaccination, and the most common one I think I come across is my child's got a bit of a cold, but unless it's a good going fever, they're actually fine to have the vaccine and would certainly be encouraged to have it. In terms of having a fever, I mean, once that's settled and they've recovered from the illness, then they're able to have the vaccination. That's my understanding. You can see the rest of the list there. That those listed there are not contraindications. So any past history of convulsions, any family history of adverse events doesn't mean that the child can't be vaccinated. Any atopic history of asthma or eczema. History of jaundice. So there's a long list there that people will come in with, and those aren't reasons to either not vaccinate or to delay vaccination, and that's worth knowing, and probably worth staff in the practice knowing too.
Yep, great. And Vicky, our place to find the exemption form.
That's right. So linking off that same page that we saw before, and I think then the next slide shows a new exemption form. It's a double-sided form. And so it's quite clear that as Tim said, GPs are certifying, and only GPs can fill in this form. Not specialists can't. So a paediatrician, for example, is not allowed to fill out this form.
Right.
But so a GP in signing this form is saying either the child has had a severe allergic or anaphylaxis to an antigen, it has to specify which antigen, or natural immunity, and as we discussed before, that's only for a limited range of conditions.
Yep, okay. And we talked earlier about the immunisation history form, a very important form, and this is where we find it?
Yes, and again it links off our website, and it's also available from the Commonwealth. It's changed a little from the old form in that there's no longer an opportunity for the GP to enter a review date. That's automatically set. And so this is important to lodge this form when when a family comes in, as we discussed before, you've got a record of their vaccines that hasn't been transmitted, so that can be lodged on this form. Or if you've started them on a catch-up, once this form's lodged, then they can start to get their payments before the catch-up's finished.
Yep.
Yeah.
Okay. And looking at one of the diseases that's covered by our vaccination schedule, Vicky, can you tell us what's happening with pertussis?
Yeah, well, I think last May we did a webinar on pertussis, Michael, and so at that time we predicted that we were heading for an outbreak, and so this shows the number of notifications in New South Wales from 2005 to the end of 2015, and we did pick it right, and it's not that hard to pick because that's what happens with pertussis. So we peaked in November 2015, where we had over 2,000 notifications in that month, and over 12,000 last year. But while overall in New South Wales it's dropping, we know that some parts of the state the numbers are still increasing, and that's the nature of a whooping cough outbreak. So only recently has taken off in northern New South Wales, for example.
Right. And we discussed these 3 key points at that immunisation webinar, didn't we?
Yes.
Yeah.
So the new evidence about vaccinating pregnant women at 28 weeks had just come in.
And that's for every pregnancy, isn't
Every
it?
pregnancy, and that vaccine's available through GPs or antenatal clinics. So we're hoping that GPs are promoting that vaccine. And we are doing a case control study in New South Wales looking at the effectiveness of that. So we hope to have some results on that in the next 6 months.
And that's looking at the bubs under the age of 6 weeks before they get their first immunisations, the incidence of whooping cough.
That's right.
Pertussis.
Yeah, and the level of protection provided by the maternal vaccination.
Yeah.
We also mentioned at the time about the 18-month booster, and it has been announced by the Commonwealth as being free. And we're expecting it will be available in March, but we still don't have definite advice on that. So we will be faxing out to GPs and putting information in deliveries and on the state vaccine order website as soon as we have definitive information about that program starting.
And I guess with that will be what's the latest age they can get that 18-month booster?
Exactly. Who's eligible to have the free vaccine?
That's the catch-up part.
So we're not advised of that yet, Michael, but we'll get that information out as soon as we can.
Yeah. Sounds like another webinar coming up. And of course,
we've got some questions coming through as well.
Yeah, and of course we discussed the guideline-based treatment of pertussis.
And that's right. Yeah. So and interesting, really important to emphasise. So while azithromycin is once a day and highly recommended and effective, good old Septrin and Bactrim are equally as effective and probably more affordable than azithromycin.
Yeah. While on the question of pertussis, Dr. Corrin has asked, we're having a difficult time in the Northern Rivers with children who are immunised are getting pertussis, so it makes a hard argument for those who don't want to immunise. Tim and Vicky, could you add some light to this question?
I'm happy to have a go at that first, if you like, Tim. So I think the whooping cough vaccine, I always say it's different from our other vaccines. It's not like measles. It doesn't give us lifelong protection. But similarly, whooping cough infection only gives a limited time of protection. So it's a little bit more like the flu in that our body continuously needs to be prompted in its immunity against whooping cough. But the real benefit of whooping cough vaccination is it prevents severe whooping cough. And that's most important in young infants who are most likely to be hospitalised, but it also is more likely to prevents severe infection in other age groups as well. And so that's important.
Yeah, so the cocooning effect as well.
Well, cocooning is important, but for the individual, they can still be susceptible to whooping cough if they're vaccinated, but they won't get severe disease. So if you remember back, those of us who are able to remember back to the pre-vaccine era, even 2-year-olds and 3-year-olds and 4-year-olds would die from whooping cough.
Yeah.
So we don't see that disease anymore. So the vaccine doesn't prevent disease, but it prevents severe disease, and very important for protecting infants.
Tim.
And I was going to add partly as a comment and partly as a question about the importance of herd immunity for that, whether there's having the more people who get vaccinated, then the more the whole community is protected from it getting a foothold. And so it's actually an unfortunate consequence of other people not being vaccinated as well, when people get who are vaccinated pick up the disease.
Yep. Vicky, we mentioned that pregnant women need a DTP booster or a pertussis booster at 28 weeks of pregnancy for every pregnancy.
Yep.
Dr. Singh has asked, what about with sort of significant other adults who'd be in contact with the baby? How often do they need a pertussis booster?
Well, at the moment, the recommendation is only every 10 years. So it's certainly not as frequent as for the women.
Okay. And Dr. Sen has asked, they're seeing lots of chickenpox in vaccinated children in primary school, and should we be bringing the booster dose earlier?
Well, so with varicella, in fact, we've only got one dose on our schedule, which is the 18-month dose. And it is known that one dose of varicella vaccine is probably only about 80% effective against chickenpox infection.
Yep.
So we do expect to see chickenpox outbreaks, unfortunately, until a time when we get 2 doses funded.
Yep.
But, it could be a recommendation for a parent if they wish to more fully protect their child from chickenpox, that they could pay for a second dose of vaccine.
Yep. And Dr. Cartwright has asked, where does erythromycin fit in? I presume that's in the treatment of pertussis. And I think at the webinar we discussed that erythromycin is not well tolerated and there's some resistance and side effects.
Well, there's not, in the latest version of the therapeutic guidelines, erythromycin is no longer recommended.
Yep.
And that's about tolerability and dosing, because a minimum of 3 and really recommended 4 times a day is needed for whooping cough if you're using erythromycin. So the therapeutic guidelines removed it as a recommended agent for whooping cough.
Yep. Okay. And Dr. Peer has asked, is the pertussis free for the partners of pregnant women?
No. So at one stage that was the case back in 2010, 11, 12. We've ceased that because a case control study that was done at the time showed that it wasn't effective in reducing the risk to infants. So we're funding the vaccine that's effective in reducing the risk to infants, which is the antenatal vaccine at 28 weeks or thereabout for women.
Yep. Okay. And Dr. Patniak has asked, if the patient claims to have chickenpox or measles or hepatitis B overseas, can that be classified as medical exemption?
Having had the disease?
Yes, yeah.
Well, probably not.
No, Hep B would have to be serology.
Well,
anyway.
certainly Hep B, you have to have serology.
Yeah.
And as we discussed, measles is a hard clinical diagnosis anyway, so I don't think I'd be signing that. And similarly, chickenpox, if you're unable to observe it yourself, I don't think I'd be certifying that they'd had that. And probably serology would be needed to verify that medical exemption.
Okay. Tim, a question for you. How do we approach teenage refusal for the vaccine once the vaccine has been prepared? Dr. Mansfield has drawn up a couple of vaccines and has to discard them due to the patient's refusal. I guess that's a tricky one, isn't it?
It is tricky. It's a really good, I mean, even just hearing that question, I think we all have pictures of that happening in our mind, and we've all had it happen to us. I mean, it's really tough, and I think in the end, it's very hard to give a vaccine to a moving person, and I think ultimately, if someone is having a sort of almost a panic attack or becoming that upset about having a vaccine, there's almost no option than to pull back, and either if there's time to calm down in the practice and give it later on, then do that. But I think very often that there won't be much option than to sort of wait, do it another time. It may well be that that's that we call for help from specialist colleagues in the sort of complex vaccination unit or something if there's a genuine almost panic attack each time that like a needle phobia or something each time you get close to having a vaccine.
That's certainly possible. The team at Children's Hospital Westmead have used sedation and other things, particularly for children that might have developmental problems as well. But if I could just, our nurses that vaccinate adolescents every day in high schools try to use distraction. So even to get them to play a game on their phone or have a puzzle that the child could be concentrating on. And it's important not to say it's not going to hurt, but you can reassure them that it will be quick. And I think those words are often assist, depending on how distressed the teenager is.
Yeah, absolutely. And everyone else in the room too. I mean, I had a situation recently of, it wasn't vaccination, but very anxious teenager with what they thought was an asthma attack, but it was anxiety, and everyone else in the room also picking up on the anxiety. And so being a calming presence yourself and having techniques that you can do to calm everyone, often including other staff in the room, and be a calming presence can help too.
Vicky, I'm not sure if you can answer this one, but do childcare centres have to accept a child with a signed exemption form?
No, there's no requirement for a childcare centre to accept, and they can make their own decision about who they wish to enrol.
Great. Thanks for your question there, Dr. Young. And okay, I think we've just about covered most of our questions there. Just scrolling through
There is one there just about some difficulties with partners and family members being able to obtain pertussis vaccines, and there is a shortage of private supply of pertussis, I gather, that can make it difficult to get hold of in some areas, but not a shortage of the public supply. Is that right?
Yes, that's right. All the pertussis vaccine is imported from overseas to manufacturers, and they've been struggling to meet demand. Obviously, we've purchased a lot more for pregnant women, and we've got plenty for our school program and children. So the different locations at different times, there has been shortages. One option there's often available on the private market, Boostrix IPV or Adacel IPV, a little bit more expensive, but sometimes grandparents are very anxious to get that vaccine, so they might be able to source that. And the manufacturers have told us that over the next couple of months they should be able to meet demand more readily. But I know if a new baby's arriving in the next few weeks, that's probably not satisfactory for some families.
All right, well, let's review our learning. I think we've covered these pretty well. We can certainly recognise the implications of the no jab, no pay legislation on general practitioners. And we've looked at the recent and the future changes to vaccination requirements with families, including the new exemption rules. And we now know how to review the immunisation records and follow up our juvenile patients up to the age of 19 to ensure that their vaccinations and reporting are up to date. And of course, we've discussed the importance of timely vaccinations with patients. And we've looked at the medical requirements and true reasons for exemptions due to ill health. And they're fairly limited now, aren't they, Vicky? Just a reminder about the upcoming webinars. We've got the flu vaccination update, and Vicky, we've certainly got some innovations and some new changes this year, haven't we?
Yes, big changes with quadrivalent vaccine this year, so we'll spend some time working through that.
Yep, so I advise all of our participants tonight to look up the faculty events calendar and make sure you register for that webinar. We've also got a travel medicine update in May, and also the shingles vaccination for 70-year-olds in September. So a couple of great webinars to look at there. Well, our time is up, ladies and gentlemen, and I thank you, all of our participants, for their wonderful questions. They've been very high-level questions tonight, haven't they? And really on the mark. And of course, our thanks go to Vicky Shepherd and Tim Senior for their expert input into tonight's webinar. And thank you both for making it such a success, and look forward to working with you again in future webinars.
Thanks, Michael.
Thanks very much. And
thank you very much, Michael. Thank you very much, everyone. I do hope you found it useful.
Good night, Tim.